front of your screen is the right kidney in longitudinal section from prone position, measuring 7.3 by 3.3 centimeters. The dimensions are normal. Fine. Second thing, the echogenicity of the parenchyma is diffusely raised. There is no differentiation between the cortex and the medulla. No medulla. There is no medulla. These are the dilated calyces. Central sinus echocalyces. Fat is muffled totally. Don't see any fat in the collecting system or the central sinus echo complex. You can see that the outer capsule is not visualized with clarity because of small amount of fluid posterior to this is the capsule. This white thin line linear structure is the capsule, and below it you can see that there is fluid. Now this is the condition of the left kidney that is giving us grade 2 renal parenchymal changes. However, no calcification, no focal lesion is seen. Now I am going to focus towards the right kidney, and again you will see that there is fluid in the subcapsular region. You see the capsule is muffled. This is the fluid. This is the parenchyma of the right kidney, and the parenchyma appears to diffuse increased parenchymal echogenicity. The corticomedullary differentiation is again muffled in this kidney. This is the kidney. This is a small amount of fluid below the capsule, the subcapsular fluid. The kidney measures 8.1 centimeter in length and 4.2 centimeter in anterior-posterior diameter, with no central sinus echo complex seen. It is totally muffled. There are no medulla seen. However, a few dilated calyces are seen. So these changes are also consistent with dilated calyces. As you can see, the proximal ureter is not dilated. So this is what we call as grade 2 renal parenchymal changes or chronic renal failure. But the case is that we have some other findings in this case as well. Here you will see that this is the spleen. Spleen shows diffuse decreased parenchymal echogenicity. As you can see, the tiny radicals of the vessels are quite prominent. There is fluid in the abdomen. This is the spleen, and there is fluid in the pleural space. Here you have. This is the fluid in the pleural space. This is the ligament. Splenorenal ligament, and you can see it dancing within the ascitic fluid, as this is the kidney. And now determine the echogenicity of the kidney with that of the spleen. So there is pleural effusion. This is the pleural effusion, and this is the ascitic fluid surrounding this spleen, and this in the splenorenal angle as well. There is fluid in the right paracolic gutter. This is the the left paracolic gutter, and there is fluid in the There is fluid in the peritoneal cavity. This is the urinary bladder. This is the prostate. This is the urinary bladder. This is the prostate. these are normal, and here you see that this is the urinary bladder, this is the ascitic fluid, and these are the bowels. Again, when I go upwards, I see fluid in the right Morrison's pouch, right paracolic gutter. This is the right paracolic gutter, and you can see the bowel segments do float in the right paracolic gutter. Fluid is also seen surrounding the liver. Now this is the liver. See that the outer surface is smooth. The liver echogenicity is normal. The ecotexture is homogeneous, and this is the fluid surrounding the liver. However, there is no significant amount of fluid seen. No fluid seen in the right pleural space. This is the right hemidiaphragm. This is the liver. This is the portal vein. This is the IVC. And this is the spleen. This is the gallbladder. Just see the smooth outer surface of the liver. Smooth outer surface, homogeneous texture, normal. The heart is dilated, all the cardiac chambers are dilated, and the finding is consistent with the cardiac myopathy. This is the heart. Just see the thickness of the myocardium. The interventricular septum. This is the heart. All the chambers are dilated. Heartbeat is at the time of ultrasound 66 per minute with regular waveform. So we see congestive cardiomyopathy. Here you can see the mitral valves. This is the aorta. This is here we should be able to see the IVC. This is the IVC, inferior vena cava. The hepatic veins are not congested or dilated, so these are the hepatic veins. This is the right middle. These are the middle hepatic veins. This is the right. So this is the case of bilateral grade 2 renal parenchymal changes with ascites, PATHOLOGIES, cardiomyopathy. So a complicated case that started from cardiomyopathy has advanced to bilateral renal parenchymal changes of grade 2 You see that the echogenicity of the renal parenchyma, right kidney, is much more raised than that of the normal liver. So this is the case of today. Thank you.